I'm Dr. Patrick Brooks at the Jacksonville Orthopaedic Institute at our Beaches location. I am a hip and knee replacement surgeon here at this office, here to talk to you guys today about what revision hip or knee replacements look like. Revision is when you have to go in there and fix a prior painful hip or knee replacement. While the vast majority of hip or knee replacements are very successful, there is a small subset that do fail for various causes. This could be from infection, loosening, or just mechanical failure and wear and tear of the joint. Sometimes if those symptoms are bad enough, we do have to go in there and fix that problem. There's a full revision, which is where we have to take out the old implants, all of them, and kind of start from scratch and then reconstruct it from there. Or depending on the cause of the failure, if the plastic is worn out or you're having dislocations, occasionally we can do what's called a modular exchange, where we just take out the components that are exchangeable and start with that. What are some warning signs that can show us if your hip or knee is failing? Could be increasing pain, swelling, instability symptoms, or the knee or hip is buckling or giving out on you. Those are signs that you may need to go in there and get that joint evaluated. The goal of revision surgery is to restore quality of life and function back to the patient's lives. So if you have a painful hip or knee replacement that is progressively limiting you from doing things you love, and you can't do basic activities or things you enjoy doing, then it may be time to come in and get a revision surgery if it's indicated. Oftentimes, revision surgeries are after we attempt conservative management in the form of physical therapy and bracing. So just because you have a painful hip or knee replacement doesn't necessarily mean that you need a full revision, although that may be the case, but we often will address this based on the presentation of the patient, what the cause of failure is. We usually start with the detailed history, previous x-rays, as well as current x-rays, typically basic lab work, and sometimes advanced imaging in the form of a CT scan or MRI. Although surgeries can be a lot of work, they can provide a lot of significant improvement and functionality back into your life.